was a perfume of a million flowers clinging to the heart of old Hawaii.
In 1967, the Waikiki Drug Clinic was established when a handful of community members were concerned about the growing problem of drug use among Waikiki's young people. Their response to this unmet community need became the foundation for Waikiki Health's mission to provide quality medical care and social services that are accessible to everyone, regardless of their ability to pay. In 1968, Waikiki Drug Clinic takes permanent quarters in a cottage at 319 Paoakalani Avenue, owned by Liliuokalani Trust. The Waikiki Drug Clinic changed its name to the Waikiki Health Center in 1977 to better reflect the shift in emphasis from a single diagnosis clinic to a more general health and medical center. Our clinic began offering expanded primary and preventive care and became a nonprofit agency. Funding from the Aloha United Fund, now known as the Aloha United Way, supported the hiring of Dr. Neil Nguyen, co-founder of the Waikiki Drug Clinic, as our first part-time physician. Reverend Frank Chong served as the executive director and expanded the clinic's outreach and program services. Reverend Chong was one of Hawaii's strongest advocates for better community health. In 1982, the Waikiki Health Center moved to 277 Ohua Avenue, which was the former living quarters of the Sisters of St. Augustine. Our Chief Medical Officer, Dr. Elliot Kala'ava, joined the agency in 1986, and under his leadership, Waikiki Health Center began offering the most comprehensive care in Hawaii for HIV patients, supported through federal grant funds. In the late 1980s, Waikiki Health Center introduced 3 new programs to serve the growing needs of helping the homeless, the elderly, and the at-risk youth populations. Caravan was established in 1987 to serve homeless individuals and families by offering primary care, behavioral health, mobile outreach services, mailbox services, assistance with obtaining state IDs, and housing case management. Today, the focus at Caravan remains on medical and behavioral health services. Our Friendly Neighbors program, also founded in the late 1980s, provides volunteer support and companionship for seniors living independently in the Waikiki area. Youth Outreach, also known as YO, was established in 1989 by Waikiki Health and Halekipa to serve homeless and other at-risk youth in a safe and non-judgmental environment. In 1997, Native Hawaiian healing was incorporated into our primary care program, implemented by Francine Dudua Tagupa, offering Lomi Lomi, Ho'oponopono, and La'au Lapa'au. As the needs increased for our services in 2008, Waikiki Health Center named Sheila Beckham as its new Chief Executive Officer, beginning a dynamic period of growth in patients, staff, and services. Waikiki Health Center was awarded federal funding in 2009 to purchase Oahu's first mobile medical clinic, an exam room on wheels. Our Caravan program is now able to take the privacy of the clinic to the beaches and rural areas of Oahu to serve the homeless wherever they are situated. In 2010, federal stimulus funding, along with generous gifts from individual donors, supported the renovations and upgrades at the Ohua Clinic. This included the construction of 3 additional wheelchair-accessible exam rooms for a total of 15 exam rooms. Waikiki Health Center also opened its first pharmacy at the Ohua Clinic. In 2011, we began operating 2 more facilities, Next Step Shelter in Kaka'ako and Path Clinic in Kaimuki. Next Step Shelter provides shelter and job training services to homeless individuals with compassion and respect. We work with people to address their barriers to housing and provide them resources to move into permanent housing with assistance from our housing navigators. PATH Clinic, also known as Perinatal Addiction Treatment of Hawaii, provides comprehensive perinatal clinical and educational services to women with past or present substance use issues in a home-like setting free of judgment, supportive of each woman's unique path from pregnancy to having healthy babies to being a capable parent. Waikiki Health Center rebranded to Waikiki Health in 2013 to create a strong brand and positive image to attract new patients, increase patient retention, raise awareness among target audiences, highlight the quality and expert care provided, and improve the organization's overall brand image. To meet the growing demand for our services, in 2014, we opened the Harry and Jeanette Weinberg Makahiki Medical and Dental Clinic in Makali, Mo'ili'ili neighborhood. The new site houses 8 exam rooms and 7 dental operatories, providing primary medical care, behavioral health, oral health services, and a second pharmacy. In early 2017, the Makahiki Clinic began an expansion of its 3rd floor. The space is being transformed into 11 additional exam rooms, providers' offices, and other patient service areas. Once finished, the site will house 19 medical exam rooms to accommodate the agency's continually expanded patient population. Over the past 50 years, Waikiki Health has been increasing access to quality care by adding new programs and clinic sites to serve the growing needs of our patient population. With the continued support from donors like you, in the next 50 years, we will be able to continue our mission of providing quality medical services to everyone regardless of ability to pay. Mahalo for your support.